Hello guys, and a big welcome to my YouTube channel. Thank you so much for subscribing and thank you so much for watching. Today we are going to be talking about the different ways in which one can join the NHS as a healthcare assistant or as a healthcare support worker. So I'm so passionate about healthcare because I came to the UK 2 years ago on a skilled worker visa from Zimbabwe as a healthcare assistant. So I'm passionate about it. It's a profession that I do love, that I enjoy, and those of you who have followed my story, you know that I've got an engineering background, but I fell in love with care and I'm enjoying it so far. 2 years into it, and I still enjoy it. No wonder why. I want to share my experience with all of you guys, and I do hope you get inspiration, and I do hope it makes you think whether or not you want to join. So guys, let's get straight into it. So there's three ways in which one can actually join the NHS, which is the National Health Services, which is like the biggest recruiter of healthcare professionals in the UK, and that's like the biggest. This is the biggest. Okay, so the first way in which one can get into the NHS is by directly applying when job vacancies goes out. This can be on Indeed, and this can be like when you log in onto Trek. I've done a video about how I got into the NHS. You can actually go and watch that video. I went through the whole Trek website, so you can actually go on that one. I'll put the link in the description box to that video. But it's when you directly apply when they do put out vacancies, of which they've got like loads and loads of vacancies going on. I think the last time I checked, they had like 15,000 vacancies for healthcare support workers or healthcare assistants going on the whole country. So you can imagine, I'm sure there's a spot somewhere for you specifically. If you are thinking about joining the NHS, then you're in the right place. So this is when you just go on, maybe on an Indeed advert, and then you click in, but then it takes you directly to the Trek website, whereby you log on, create an account with Trek, and you log on and you begin to apply. So this is one method in which you can actually join the NHS. And of course, when you do a good job with your application on Trek, and when you do come up with a really good personal statement, chances are you will get a job with the NHS. Definitely, because they need people. The NHS needs you. So that's one way of getting into the NHS. The second way in which you can actually get into the NHS is through joining their bank healthcare team. What do I mean by bank? This is when you are not working full-time for the NHS, but you cover bank shifts. This is when maybe wards or maybe hospitals cannot cover certain shifts, and they put them on the bank app for bank staff to pick them up. I love bank staff because that's how I initially got into the NHS. I joined a bank team with the trust that I work for now, and it was through that I said, well, my mind is made up. I want to join the NHS. And I think a few months later, I did join the NHS on a full-time basis. So it's a good way of starting. Why do I say it's a good way of starting? It's because you could be in your job and you're not too sure whether you or not you want to join the NHS. So it's a good place to start, because you get an insight into what the work entails. You get experience. The good thing about working on bank is the fact that you can work anywhere. You can pick shifts in any ward, in any environment that you want to work in. It could be community hospitals, it could be the acute, it could be with any department, to be honest. So it gives you a chance to experience the whole hospital experience. You get to pick shifts in different wards, and then eventually you get to pick which ward or which department you want to work for. So it's a very, very good way to start. What normally happens is some trusts, they do actually like put out on Indeed, like I said, on search engines, to say we're looking for bank HCA or bank support worker staff. But how I got into the NHS as a bank healthcare assistant was the fact that they were the trust that I work in or that I work for was running a recruitment event. So I saw the event on Indeed, and I applied. After applying, I got an invite to the event, and then that's when I attended the interview. It was a different way of getting interviewed. I think I'll do a video about the difference, because it was different the way I was interviewed at the bank recruitment event, and the way I was then interviewed for the NHS job that I have now is quite different. So I think it's worth sharing with everybody. But it's a good experience when you see those recruitment events, guys, and you're thinking of maybe switching into the NHS. Please do grab those opportunities. It's a good way of getting into the NHS, and it's a beautiful experience altogether, and they do need people. When you see trusts or hospitals going on a mass recruitment drive like that, it means they're desperate, and it means there's a spot for you if you're watching this video today. So that's another way of getting into the NHS. And one thing I love about a bank healthcare assistant or bank healthcare support worker is the fact that you work when you can. You are in control of the shifts that you can pick. It's not like you are, you're forced or you're coerced. No, but you get to pick whenever you can. So this can work if you're in a job already, or maybe you do other things, or maybe you've got like childcare and stuff. Then you can pick shifts when you can cover them. There's just one thing that stood out for me, the fact that maybe they said you are obliged, obviously, for you to stay on their system, on their books. If you're on bank, you have to work for them one shift at least every 3 months. I mean, honestly, that's a plus, because I mean, that's in 90 days you are only obliged to cover one shift. So I mean, that's absolutely amazing. But there's always shifts going, and if you've got plenty of time on your hands but you don't want to commit full time, join the NHS bank staff. Why? There's plenty of shifts going on at any point in time. You could actually end up like working more, so it's a good way to start whilst you're still deciding whether or not it's for you. So in these roles, guys, I have to say this, they are, regardless of your gender, whether you're male or female or whatever, it is for you, it's for everyone. For as long as you love care, for as long as you're caring in nature and you love doing this, you love the job, then just know that this video is for you, and this is for you to try. So the third and last thing that I'll talk about in this video is volunteering. Guys, there's a few things, because this is exciting, guys. I didn't know much about it, and I was a bit skeptical about sharing on it until I did my research, and I'm going to share with you in detail how to join the NHS through volunteering, through joining as a volunteer support worker. So this volunteering is a pathway to NHS employment. So definitely it falls into what we're talking about today. So this is it's an initiative that was started, or that is run to assist staffing shortages within the NHS. Guys, if you live in this country, everywhere you go, everyone is talking about these shortages and the impact on it, and every hospital that you can think is trying to do their best to be fully staffed, fully equipped, so that they can deliver a better service. It's one of the things that they do commit to, and it's one of the things that they are hoping to work on and achieve the results, guys. So if you're watching this video, then definitely know that, be on the lookout for these opportunities, and volunteering should be one of the things that you do look at. So what do I mean? This they say this is funded from some fund somewhere. So they said you have to only volunteer in the area or in the county that you live in. That's why they are quite strict about like you volunteering in the county that you live in. So if you live, for example, I'll give an example to say, if you live in Cumbria, then you can actually do volunteering within this trust. But if you do live anywhere else which is not here, then you have to look at the trust that is within the area that you live in. So one of the things that I want to talk about is the eligibility criteria for volunteering. So this is open to everyone that is interested in a career in health and social care, which means if you're watching this video, this can be for you. And by the way, we're talking about people that are in the UK in this video. But the first one that I said, you can apply to the NHS directly. This can apply if you're overseas. You can actually apply directly and see how that goes. And we do wish you well. So they say it's open to everybody who is interested in career in health and social care, which means if you know deep within you, you're caring, deep within you, this is for you, then definitely, if you're compassionate, kind, and willing to learn on the job, then this could be for you. Then you have to be someone who can commit to do 60 hours in seven months. Guys, this is so flexible. I would say, guys, even if you're in your old job, you are doing domiciliary care, you're doing support work, you're doing living somewhere else, please, this is worth trying. This is, a lot of people do not want to do this because I'm sure you don't get paid because it's volunteering, but it's a good way of getting in there. And I'm sure when internal vacancies come up, you get preference. So I would say, if you have been trying to get into the NHS and you're failing to break through, then try volunteering whilst you're in your other job. You can actually maybe do, one shift a week or half a shift a week, and then you build towards the number of hours that you have to do. And trust me, you will, because I know certain people who did volunteering and they ended up going into the NHS. So the other criteria again is you have to be 18 years and older, obviously. And if you're watching this video, you have to, 18 years and older, then you can volunteer with the NHS as a pathway to career. Then you need to have the right to work in this country. I mean, honestly, for you to work anywhere in this country, you have to have the proper documentation. You have to have the right to work in the country. So we cannot overemphasize the fact that always make sure you do have the right to work, because definitely the organization will ask you when they do their checks and verification and stuff, they will ask for your identification and stuff like that. So make sure you do have the right to work in the country. Also, the other thing is you should be ready to go through recruitment checks and training requirements. I mean, I'm sure that's where they talk about your DBS and things like that, for you to declare if you have any convictions, things like that, if you've got any disability and things like that. So you should be willing to undergo all those things for you to become a volunteer with the NHS. So guys, this is really worth exploring. This is really worth exploring. So I'll go into some of the things that you will be doing as a volunteer, guys, because I'm sure the other things that I mentioned in that video, I think I went through what you will be doing on the road. But as a volunteer, these are some of the things that you'll be doing. This is to offer companionship and support to patients, whereby you just sit with them, talk with them, just be with them, just offer support. And at times, depending on their needs as well, you could be doing activities with them, games, reading, and just general chat. So make sure you're somebody who is really willing to be exciting. Oh, I can see a jet over there in that video, guys. That's the beauty of, just these random videos where I'm outside. Partly it's because my children are back from school and they're in the house, and I don't want them to feel like, oh, mom, you've started again. And at the same time, I do feel the need. When I do feel the need to come here and speak to you guys, I have to do it. And what a nice way. I mean, it's still nice and warm in the UK, so it's good to be outside. So guys, as we continue, part and parcel of your duties as a volunteer within the NHS is to assist the nutrition coordinator to deliver meals to the right patients, help assist patients with feeding, drinking, and so it's part and parcel of what you do. Make sure they've got all the things that they need at hand when you offer them food. That is, make sure they've got the right cutlery, they've got water, salt. It's the little things, but then they do make a difference. And sometimes, depending on maybe on the health needs or on the rehab needs of a certain specific patient, some require specialized cutlery, and it's your job, or it's part and parcel of what you do to make sure, okay, they've got the right cutlery, because some of these things can be overlooked sometimes because of how busy the ward can be or how demanding it can be at times. So as a volunteer, it's your job, when you're just checking everybody, do you have everything you need? Do you have everything at hand? Do you need anything? Then you can actually check. And some people, they do need like just their food cut up for them depending on what they are having that day. So you are just assisting with that, just to make sure their nutrition needs are met. And part and parcel of, I think I spoke about you helping feed them, because some patients really need assistance with feeding. So you'll be doing that as well. Excuse me. Also, part and parcel of your duties is to help with patient experience by providing friendly and emotional support. Sometimes maybe they've just been told really sad, devastating news. You know what happens with health and being in hospital. Part and parcel of your job is to just make sure you comfort them, you offer them support, just hold their hand sometimes just pass them a napkin to wipe those tears. It goes a long way, trust me. Sometimes just holding their hand, a squeeze or a pat on the back, just to say, it's going to be all right. Just offering support is part and parcel of what you do as a volunteer. So what is it that I wanted to say as well? Just to offer reassurance for families as well. As a volunteer, sometimes you see them, they're struggling or they're crying. You just go like, okay, do you need, have some water? Do you need a coffee? You go and make them. That's part and parcel. Just do the little things, but they do make a huge difference. Trust me. Sometimes you are so devastated, you're crying, you've received news, and then someone just says, do you need anything? can I give you a glass of water? And you actually, yeah, I do need it. So yeah, that's part and parcel of what you will be doing as a volunteer. So part and parcel as well of what you'll be doing is just to support the healthcares and the nurses on the ward, just to, offer companionship or offer company to patients. Sometimes it can really be so busy, and then maybe there is that one particular patient who really needs like a one-to-one, or who really needs someone all the time. So it's your job. You can say, okay, I'll go and sit with so and so, or okay, I'll take so and so for a walk. It's part and parcel of what you can do as well. Part and parcel of what you can do as well is to run errands for patients. Some patients they cannot do without their newspaper, and sometimes their families bring them for them, and sometimes when they can't come, then it's your duty to say, okay, I'll go and get you a newspaper, or I can go and get you this and this. And sometimes, depending again on maybe your hospital, sometimes someone maybe smokes and they are allowed to, so you take them out for a smoke, or you take them to the vending machine or to the restaurant, depending on their needs and what they are allowed to do. You can offer to do all that. So guys, I think that's everything that I had for you today. Do not sleep on these opportunities. Do apply. It's beautiful to work for the NHS. It's lovely. It's a beautiful experience. I know you're having the best time where you are, but in terms of opportunities and certain things, the NHS is the place to be. I think I'll do another video where I'll talk about the benefits of one of the reasons why you need to be in the NHS, guys. And thank you so much for subscribing. Thank you so much for watching, and continue to share our videos. And if you haven't subscribed yet, please do hit the subscribe button, and also hit the notification bell so that you don't miss any of our videos. We love you, we value you, and see you in the next video. Bye.